Hi, today I'm going to be showing you how to dry skin brush after you've had either lymph nodes removed for surgical reasons or possibly radiation to an armpit area. Okay, so we're going to have our dry skin brush. You want a natural bristle brush, and I'm using the handheld version that does come with a long handle, but for my purposes today I won't be using it, but if you have one you're welcome to use either type. Okay, so if you've had lymph nodes removed, we're going to pretend it's from my left arm. We don't want to dry skin brush the same way, just as I don't do lymphatic massage for those clients the same way as I would someone who has all their lymph nodes intact. All right, so what we want to do is we're going to be reversing the flow to other alternate areas to handle the fluid and lymph that needs to be processed and detoxed and excreted from the body, but these lymph nodes are not here to process that. Okay, so we want to start here in the chest below the clavicle, and we want to do circles, and this is not hard, this is just right on the skin. Okay, and we want to do up to 5 minutes, but at least 3. The longer you do it, the more benefit you'll see quicker. So if you have the time, do these circles here for 3 to 5 minutes. And once you do the first side, then we're going to come across to the second side, just below the clavicle. If you need to pause here, please do. I'm going to go ahead and move on to the next point, which is actually going to be behind the neck, where you have an alternate area, anastomoses, that you can send fluid to. So we want to be, of course, on skin for you, right at the base of the neck, just below the neck. You want to go right here on the skin. And you want to get some really good flow going, so you can be a little bit more aggressive back here on the back side. And if you need help reaching this, then you would go ahead and use the handle attachment to be able to reach back to that point behind the base of your neck. And again, 3 to 5 minutes. Okay, and then we're going to start going towards our sternocleidomastoid, which is here at the apex of the rib cage. And if we're coming away from this area, we're going to draw fluid opposite across towards this point right here. Okay, if you put a fist, kind of like you would do the Heimlich maneuver, that's the area that we're talking about. So you'll be on your skin coming across. And again, try to do each movement 3 to 5 minutes, because we've got to give the body time to accept and react to going in the opposite direction from the normal flow of the lymphatic system. It can be changed, but it takes time. So doing this consistently for 3 to 5 minutes each time that you do it is going to really help you see results with swelling and lymphedema and things like that that result from having your lymph nodes removed from the body. Okay, we'll pretend that's 5 minutes. Now we're going to come up here to the armpit. We're going to start in the armpit, and we're going to push it back away to the back. Okay, back towards that and up to the back area again. So start in the armpit and come back. So you may want to start first just doing the armpit. Get some good movement there. Okay, and then we're going to come further around, and you may want to get the long handle for ease of use. And you can come across this way for this one. Coming up towards the back of the neck. Just like that, and a little bit of a J motion. Okay. Then we're going to come down towards your hip where the inguinal lymph nodes are. If they're intact, we want to push fluid down that way. So again, this is reversing the natural flow of the lymph system that wants to come up, but we don't have nodes to process, so we're encouraging it to flow the other way. We have anastomosis channels across here on the sides, and they can go two directions. So that's what we're encouraging, that downward flow to flow twice as much to help handle excess fluid and lymph. So 3 to 5 minutes again as you have the time. Okay. If you want, you can also encourage by doing circles over the front of the hip area, right where the leg bends. That's where the little soft tissue, you can stimulate that by doing circles here as well. Over your dry skin, of course, for you. That will just help wake those nodes up and be ready to process the fluid that we're pushing down. And we're going to come across to the other inguinal nodes and stimulate those. Going in a circle in the bend, again, soft area of the top of the thigh. 3 to 5 minutes. I'll say 3 minutes here and then 5 minutes pushing down if you're short on time. Then we're going to come across from this channel. We have another anastomosis across from inguinal point to inguinal point below the belly button, okay? Think hip bones area. Where your hip bones stick out, you want to do across that level. Straight across, moving to the side that has all the healthy lymph nodes, just to reduce the tension on the system and the load on the side that is compromised. Hopefully that makes sense. If you have any questions, please drop them below. I'll be glad to answer anyone's questions in regards to how to do this, or if anything's unclear. Okay? If you have lymph node surgery on both sides, if you notice any extra puffiness on the second side, I know a lot of times my clients are not clear on if any nodes were impacted on the second side that they're not sure they had cancer on. You can also direct down as well. If you ever feel heaviness or puffiness in this limb, you can direct that down as well on this side away. Otherwise, you would keep coming up as long as the lymph is functioning well with no problems on the second side. Okay, and we bring that in, but the normal flow is out if it's healthy. So that's why you have to do it differently with the lymph nodes being removed or if it's been radiated, because that impacts the functioning. Okay, so that is a brief overview. Then I'm going to show you how to do the arm that's impacted with the lymph nodes removed and or swelling and puffiness, risk of lymphedema in the limb. Instead of coming to the armpit like we normally would, we're going to come to this area back here. So when you do the arm, you're going to come past the armpit to the back. Okay, again, 3 to 5 minutes. And if you have swelling, you're going to do the whole arm. Start here in the upper, then do the lower. It gets into the hand sometimes. Holding it up is good. That helps gravity to assist with the drainage. I would do this 3 to 5 minutes, this 3 to 5 minutes, and then come back for a second 3 to 5 minutes as we're increasing the flow of the fluid, just to help it make sure it's getting back here to the new drainage point. And then I would do this again back here after you complete the arm fully, and then do the circles back here again. And again, you can get the long handle if you can't reach that comfortably behind the neck. 3 to 5 minutes. And then you can do the legs as normal, up towards the hip inguinal nodes. Okay, so this again is for post-mastectomy, post-surgery, anytime you've had radiation or lymph nodes removed from the arms. That would be how you would change your dry brushing routine. And you should, with the 3 to 5 minute length, you should feel an increase in urination, more lightness in the limbs, and less puffiness and collection of fluid. And you can do this as often as you need, but I would encourage at least once a day for you patients that have had your lymph nodes affected, removed, or impacted by surgery or radiation. I'm Tiffany Daniels. I hope you find this helpful. Again, ask me any questions below in the comments. Please like and subscribe. I will be releasing more videos for the legs and neck and other areas shortly. Thank you so much and have a blessed day.